And we hope that you noted that what we gave you is just the recommendations. And of course, we know we need to add the narrative with that, but we needed to get you something, and we wanted to see any input that you had also for the narrative while we were going through today. So we thought we might go like we did for the other meetings by tenet. So maybe we could start with the healthy, and anyone who wanted to comment on any of the recommendations, any of the survey questions from the recommendations under healthy, anything that we missed, anything you want to be sure we include in the narrative. It's sort of a catch-all time to be certain that, as of right now, have we included what you think needs to be included? Christopher, do you want to add anything before we turn it over to them?
Well, I was just going to say that, as Alicia was saying, what we did with each of the recommendations in what we shared with you, we shared it in two formats. One was sort of a Google form so that you could see some of the resources that we'd already identified as supporting that recommendation. And then we also shared it in the format of the survey that Alicia sent out. So as she said, we're very grateful to anybody who has had the opportunity either to respond to the survey and or to add notations in the supporting documents section in the Google form. And so obviously, as we're working forward through today and as we're drafting the report, any additional supporting information that people have or any clarifying information that people want to suggest or include, we'll gratefully accept and include in the final report. So I think with that, as Alicia said, yeah, we can start with the first recommendation under healthy was, excuse me, to increase children's access to preventative care to promote their medical, dental, and social and emotional health. And I'm just looking. One of the survey respondents indicated that a child mental health bill. So I don't know if the person who suggested that is in the call right at the moment. Because my question was, is there a bill that's already drafted that we're looking to throw our weight behind, or is it just that there isn't such a bill yet and there needs to be?
There's a children's the Children's Behavioral Health Plan Advisory Committee just met actually right before this meeting, and they have specific recommendations. Tim Marshall is the person who they're not fully prepared, but it would be a good, they've done some really detailed work in particular around emergency mobile crisis, around alternative payment methodology, as well as data integration. So they will have recommendations, if not this week, I think early next week, to be able to submit. And so I would highly recommend, if you want, I can introduce you or make sure Tim sends you the recommendations finally.
That would be great. I think ultimately, and this is, I've only been in the state a few years, so I'm still getting used to how the CGA does things as opposed to how some other legislatures do things. So the sense that I get is that our report will be sort of just a first iteration in more general terms. And as the session proceeds, we'll have the opportunity to be more specific about what we're supporting. But absolutely, I think it sounds like to connect with them and to make sure that we include their recommendations, if only as an example of the kinds of things that we think would be helpful. So thank you for that.
There's a school-based mental health bill that was passed last session that we also just went over, and I'll try to send you that information too.
Okay, thank you.
School-based health clinic, sorry, from DPH.
Thank you. And then our next recommendation was under healthy was to make healthcare costs, including the costs of behavioral and mental health care, affordable for families. And And so we cited the the state health improvement plan that was just published last month, or a month, like 6 weeks ago now, as support for that. But I wasn't sure if anybody had any, let's see. Some people did weigh in there. So if people could share, if you were the one who weighed in, if you could share what you think we should include in the report so that we're specific. Okay.
There's quite a bit there about requiring carriers to tier cost sharing and things like that that we could add. You know,
And what I would just ask, just so that we could be as precise in the language in the report as possible, would be for folks to flesh it out a little bit more, you know, so whatever they submitted, you know, so the mention of the Prescription Drug Affordability Board,
right.
you know, what's exactly meant by that, so that we can write that into the narrative under this recommendation. So
Yeah, so you can get back to either one of us, that'd be fine too.
Right. And then the third recommendation under healthy was to increase the availability of settings through telehealth, outpatient and inpatient for mental health preventative care, treatment, and crisis intervention for individuals of all ages. So again, Alice, that sounds like the work that you were just talking about would support those as well.
I think that yes, but our current system does not really pay for preventative care in any way. I mean, there are special grants that might come out of DPH or DSS, but in general, preventative care is not a billable unit of service in the state of Connecticut currently. And if there are very few places or ways to be able to afford that kind of work. I mean, it's sporadic at best. So I think that telehealth is going to be continual. Outpatient is underfunded and inpatient beds are full. So these are all really important, but there was just an RFQ that came out that was due at 3:00 today. DCF is expanding a mobile crisis to be 24/7, but they really did it with a third of the money that they needed to be able to fully do it. So Senator Anwar Sadat just put out and Representative Linehan an op-ed in the Register calling for $4.5 million for crisis services. So
so in the short term, more money for crisis services, but what recommendations would we have for preventative care to be something that's billable?
Well, I mean, or paid for. It doesn't matter if it's billable or not. I mean, sometimes
right.
a lot of people in prevention don't, use Medicaid or, bill Medicaid. So I think really having us a whole school approach to mental health, a public health approach, is the better way. And we articulate that pretty clearly in the Sandy Hook Commission description.
Okay, thank you. The fourth recommendation under healthy was to expand access to treatment services for addiction for individuals of all ages.
There's really nothing more in the survey. Nothing specific.
Okay. The fifth recommendation under healthy then was to enhance and to provide sufficient resources, including personnel and training for schools' efforts to promote students' social and emotional health, to teach social and emotional and relationship skills, and to implement disciplinary policies and practices that are educative and restorative. And we have a lot of support from the literature from that.
Yeah.
Not too much in the survey either there.
Okay. The sixth recommendation under healthy was to address payment and reimbursement issues for for service in the school setting. And then we cited that the statutory language allowing 5 sessions before parental notification prevents those sessions from being eligible for reimbursement. Oh, Anne Marie, I'm sorry. I just see your hand up now.
Hi, can you hear me?
Yeah.
Okay, so I just want to go back to that public health approach around the preventative, particularly mental health care. And I don't even know how to word this, but there's somehow in the preventative care that we need to take the negativity out of it, you know, so that we can offer services to our students, even some of our staff who have some issues but are afraid to come forward. And then we miss that window until something happens, a crisis happens, and then we're offering services. So, I mean, I'm a big believer in preventative health care. So I'm just wondering how we can address that. And sometimes, and I think it was Alice who mentioned it, like the money doesn't go there, like for preventative care. And if we did put it there, I mean, I think, you know, some of the issues that come down the road, like that we've just seen lately, may be somewhat avoidable if we're in the care earlier in the child or the adult's crisis.
So Emery, when you mentioned negativity, are you talking about stigma, people being reluctant to access it? Okay, thank you.
Yeah.
I can't see how this is not going to be a major topic. Even, you know, just today, how many high schools had to close with scares.
Yep.
So, you know, what motivates someone to do that, and how can we help people like that who are scaring others? So there definitely needs to be, and I'm sure there will be. They're just based upon the Oxford situation and now this, it's really beyond the crisis stage.
Right.
Yeah, thank you. I mean, my Norwalk office has been embedded in the Norwalk Public School all day today.
Yep.
And New Haven Public Schools were all on lockdown, and mobile crisis
Hamden.
on deployment. Hamden is closed until tomorrow, Wednesday. So it's that mobile crisis element that you talk about in point number 1. I think, and is the same thing as sort of a public health. You know, we can't bill mobile crisis for helping all the teachers process what happened in Wilbur Cross today, right? That's not a billable service through mobile crisis, but we do it anyway.
Right.
But we don't have enough staff or funding to be able to, I mean, you know, I have 12 people. So, yeah, I think that there's a push.
Right. And look at like the towns and cities that you mentioned, right? It's not just an urban crisis, it's everywhere. So we really have to be aware of that.
Thank you, guys.
I think we're on 6, maybe looking at 6. And the comment on the survey says to increase reimbursement, also add additional monies to SBHC as a comment.
Thank you. And then the 7th one actually addresses the shortage of personnel issue. Increase the number of individuals seeking to become mental health and behavioral health providers, and retain those professionals already in the field by increasing the rates paid for services and providing tuition reimbursement to those entering or already serving in those roles. And there is support in the literature for that sort of thing. The 8th recommendation under healthy was to attend to the wellness of educators and other personnel who serve children and adolescents, both in school and out. so that goes back to what Anne Marie and Alice were both saying in terms of making sure that the supports are there. And actually, because of COVID, there's a whole new body of literature emerging about educator wellness. And hopefully it won't just be a time limited fad. Hopefully it'll be recognized as crucial.
Well, we had heard at one of our meetings, not a meeting here, but an ASCD meeting, that instead of, or in addition to talking about the whole child, now talking about the whole educator, because you need to be sure that all of those same conditions are for the educators who support the children.
Absolutely. The ninth recommendation under healthy was to increase awareness of nutrition. Oh, that's why Kaylee's box just eliminated. To increase awareness of nutrition programs offered through the Connecticut Department of Agriculture, which have had low redemption rates, specifically from WIC recipients. So certainly we can flesh that out, but that's what I had, Kaylee.
No, I think it was great. I think the partnership between the Department of Agriculture and the Department of Public Health is really, really beneficial in these programs. We have seen low redemption rates, and because that is our nutrition program that is available to families and not limited specifically to seniors, it's what we have.
Okay, so we'll make sure to highlight that partnership.
Yes.
In the language, and if you have any more specific language about that partnership, feel free to send that forward so we can make sure that we include that in the narrative.
Absolutely.
Thank you.
The 10th recommendation under healthy, and most of the recommendations are under healthy, is to increase the number of employers across sectors that offer equitable and sustainable employment opportunities for all levels and demographics.
And a comment here was to maybe give financial incentives for hiring and maintaining.
Okay. Thank you. The 11th recommendation, to increase funding to expand parents and caregivers' access to the Connecticut Department of Labor's various job training and workforce development programs.
And it says to include schools here, a comment, and behavioral health community agencies.
The 12th recommendation was to create a Connecticut child tax credit.
And this comment was, of course, if this is going to be done, it has to be legislated.
Right. The 13th recommendation under healthy was to expand access to affordable, high-quality childcare and preschool, and to ensure that the professionals who staff those programs are paid at competitive rates, reflecting their levels of education and training and the responsibility that they hold.
And the only comment here was one that maybe this would need to be legislated also.
Okay. The 14th recommendation under healthy was to address homelessness among adolescents, particularly those identifying as LGBTQIA+.
So it says to include the department, the note says to include Department of Health and also housing, because the cost of housing is a concern. And then the statewide minor homelessness task force is mentioned, that has been reviewing data about younger people, looking to have a coordinated effort with case conferencing to help unaccompanied youth who are homeless.
So if somebody has a connection, I mean, I can certainly reach out, but if somebody has a sort of ready connection to that task force, we can cite some of the work that they've done in our own report.
Hi, yes, Katie Duran, DOH.
Hey, Katie.
I'm on it with some of my colleagues from SDE and DCF and others, so I'm happy to share additional info.
Oh, that would be fantastic. Thank you.
So you're still working on putting together any documents, or do you have anything already?
We were creating a guidebook. I'm not quite sure if it's
Okay.
finalized yet. I'll double check on that.
Or even any of the resources you're using to compile that might be helpful to us.
Sure.
And again, I think if nothing else, a huge, I think, benefit of the task force, our document, and our testimony ultimately will be to point the legislators to the work that's already being done by these other bodies. Because I do think, as we've talked about before, I do think that there's a lot of just because there's so much going on, they sort of overlook a lot of the work that's already being done. So I think if we can help them connect the dots and emphasize the importance of, putting the appropriate resources behind that work, that would be a huge help. And then the 15th and final recommendation under healthy was to establish a reimbursement mechanism for occupational therapy and executive function supports, and to ensure that such services are made more broadly available to children in all settings. And that was a big focus of conversation, I think, at our most recent meeting.
And the agencies to be included in the survey are schools and behavioral health.
Thanks. Okay.
Anything
So
else?
our-
Healthy? Yeah. We'll move on.
Our next tenet then was safe. And our first recommendation under safe was to increase families' access to safe, affordable housing by increasing the stock of affordable housing and increasing housing subsidies so that families are not required to spend more than 30% of their income on housing.
So there's a note about legislation, maybe about not renting if there's lead in the housing and putting a cap on the percentage. And then DOH looking to create and subsidize additional opportunities for affordable housing.
Thank you. The second recommendation under safe was to enact zoning reform to ensure that safe, affordable housing is available in all communities.
And that note here was a concern at some local communities about the fear of the residents.
Right. Which is why it has to be legislated zoning reform.
Yeah, because the zoning, right.
Yeah.
And there's some nice listings here we can include.
Perfect. The third recommendation under safe was to increase children's and adolescents' access to mentoring programs and after-school programs.
They're looking for more programs for free activities, and Hartford now has some on Saturdays. And each community sort of needs a plan was listed to do kind of similar things.
Great. And then the final recommendation under safe was to increase access to public transportation.
So what one note said, for example, if a child misses the bus to school and there's no public transportation, what happens? Or if a child needs to go to an appointment during the school, for example, a medical appointment, how does that happen and to get back to school? So those were examples of transportation issues mentioned.
Thank you. And those will be good to include in
Right.
the narrative about why this is important.
Right.
Our third tenet is engaged. The first recommendation was to fully fund the education cost sharing formula passed by the CGA in October 2017 in advance of the projected FY 2028 date. So ultimately, the plan is to get the per child payment to reflect the needs of those kids. Because right now the formula doesn't reflect that at all. But the recommendation is to achieve cruising altitude well before 2028.
We're still hopeful.
Right. Well, and I think this is one of those things I don't know that a lot of people realize that unless you've
Right.
actually worked in the schools Even some of my graduate students don't realize that.
Sure.
The second recommendation under engaged is to increase the number of individuals seeking to become educators: teachers, school counselors, school psychologists, school nurses, speech and language pathologists, social workers, occupational therapists, etc., and to retain those professionals already in the field by increasing the salaries for those roles, subsidizing the costs of tests and fees that individuals incur in the process of preparing to become educators, and providing tuition reimbursement to those entering or already serving in those roles.
So one note says maybe also to add retention increases so we can encourage people to stay.
Oh, retention, like to be reflected in the salary, you mean?
That's what it seems like here,
Okay.
so that people who come stay, and if you stay, there's some kind of a bonus, is my guess, offered, my intuition from what this reads.
Okay. Thank you. And there's plenty of literature to support that recommendation.
Tracy has something to add.
Oh, sure.
I just wanted to add, I think I heard you mention, Christopher, that, application fees or what have you, but lots of social workers and other professionals have to they have to renew their license each year.
Mhm.
So I wonder if that could be part of that. So somehow employers are reimbursing. License is mandatory to maintain in good clinical standing. I know in the judicial branch, at least for my staff, their contract reimburses them for their license renewal every year. So
That's not true everywhere. Yeah.
Exactly. Right.
Yeah.
So it's something to put in, something to think about. Some of these license renewals are very expensive.
Okay, so we would amend the recommendation for both, because there's the same recommendation for mental health folks earlier on and then
Yes.
school folks. Okay,
Yes.
thank you. That's a really good idea. And then the third recommendation under healthy was to enhance family knowledge. Enhance families' knowledgeable, confident engagement in their children's and adolescents' social, emotional, and academic development. And we did cite, that the judicial branch has a family engagement initiative under probation, and I know CSDE does too. But prior to COVID, that was something that there was a lot of work on, but it has obviously sort of petered out since then. But
Again, a note here is about the hours of availability, after school hours or Saturdays, so that it's more convenient for families to be able to access this.
Great. Thanks, Alicia. The fourth recommendation under engaged is to significantly reduce the number of mandates for schools, especially those serving students with the greatest need, who therefore most require genuinely engaging, culturally responsive instructional practices. While accountability is inarguably necessary, many of the current mechanisms for ensuring it have served to narrow the curriculum, stifle innovation, and render school less engaging for students and educators. And again,
a positive note here, Christopher, is, expand learning by doing time, which I take as, you've shown through what you are doing that you have learned this. So why do you need to maybe some of these things have that ongoing learning if you can show through what you've done that you are knowledgeable?
Perfect, thank you. The fifth recommendation under engaged.
I'm sorry, Chris, this is Alice, just a quick, can we add mental health in there? Because that exact sentence can be applied to delivery of mental health and social work services within the school too.
So
but
tell me
maybe
where you want it.
One.
Oh. Where we're talking about narrowing the curriculum and stifling innovation. Are we saying it's squeezing out?
Maybe we should have another one around, school-based health clinics and mental health services in the school that reach some of those things. I'll noodle on that and put it in the thing.
Perfect. Thank you. The fifth recommendation under engaged is to enhance the instructional and therapeutic capacity of all staff in schools through funding for ongoing job-embedded professional development and for additional full-day professional development opportunities beyond the scheduled academic year. And this is actually very related to the previous recommendation because those districts that have the greatest needs have the screws tightened most tightly on them. And what ends up happening is all of the mandates result in mandatory professional development, which uses up the limited time they already have. So it is intended to be helpful, but it actually has that negative side effect. So that's what this was about. And
No
again,
additional comments.
okay, thank you. And then the sixth and final recommendation under engaged, final for now, is to increase access to hands-on job training programs, leadership development opportunities, and civic engagement opportunities for adolescents, especially those from families with limited means. And I remember, go ahead.
No, so the comment here is maybe starting at elementary and not just maybe not using the word adolescent, but even elementary can start learning about business and investing and saving money.
Good point.
Excellent, thank you. And I remember, I think it was the Department of Mental Health and Addiction Services had submitted something before talking about, and actually we talked about this at a meeting, I think the last one or the previous one, before that, about that there are some paid opportunities where students can sort of be engaged civically, but they get a stipend from the department. So that's why we didn't talk about volunteer or whatever. And then under supported, we had two recommendations. The first being increase the diversity of professionals in both the mental health and mental and behavioral health and educational fields. And we cited similar things to what we had cited before. And also supporting documents. And then second, oh, I'm sorry. So if any comments or recommendations about that first one?
About including agencies like the social workers, NASW, MFT, APRN, who could be included. So I don't know if they have any particular documents, but they're listed as agencies that might have some information.
Okay. Thank you. And then the second recommendation under supported was to provide greater supports in school and out for children and adolescents who've been disconnected from school due to social and emotional concerns, academic delays, and suspensions and expulsions. So, Mike, I think we're all looking at you right now.
So I put in the Google Doc 3
yes,
things that I think people should look and read and get a sense of, from where we come from. Like everyone keeps saying, when I hear mental health, I think there's some confusion around that, at least in our world, because many of the young people that we deal with, many either have therapists, have had therapists, and what they need is, we call them youth development professionals, many are BAs, but their whole thing, it's not to deliver therapy. It's to get them to therapy. It's to get them back engaged in school on a regular rhythm so that they can be ready, willing, and able to show up, to learn, to participate in activities and all the things that we're recommending. So I think there's an intermediate step before we say, okay, they all need therapy, because again, our group have all used all the great, family centers, family and children, and it's just for whatever reason. So we just want to make sure that that's acknowledged or put somewhere.
So it's really to facilitate access, right? To get them where they need to be. Let me ask you this too. Because I'm a giant nerd, and so if you give me a link, I'm going to go right to it and read it. So I was reading the report from Parthenon.
Yeah,
I think it was that report, right? And they distinguished between disengaged and disconnected. So is this where we want to use both of those terms, or? Yes,
we do want to use both. I have to, because some people use it differently. Like Domi uses it in a certain way. Like I just was on a call with somebody else and they use it differently. So now I'm afraid I'm going to say it in the wrong way. But yes, I can send that. I can send that out to you as to how Domus uses it, disconnected, which I believe many in Connecticut use as well.
Okay, thank you.
Yep, thank you.
And then the final tenet is challenged. And actually, this was helpful because, again, being a nerd, I went back after our most recent meeting to look at what the legislature had done or what had been done most recently about access to community college. So the first recommendation is to expand CSCU's PACT program, Pledge to Advance Connecticut program, to cover students who are already enrolled in community colleges and students who need to enroll part-time due to family or work obligations. Because the PACT program, when it was created, if you were already a student at a community college, you were going to be, I almost said SOL, the full thing, but you'll be out of luck. And if you're somebody who needs to enroll in community college on a part-time basis, because you just don't have the childcare or the elder care, or you have to be working, then you're also out of luck. So the recommendation is to expand that program to sort of cover all those folks who, to be honest, are a goodly proportion of the folks who go to the community colleges. And then secondly, to return Connecticut's funding for state colleges and universities to the pre-recession levels in order to increase access for young people whose families have limited means, because we still haven't, I think we're still 20% below in terms of state subsidy for the public institutions of higher learning. We're 20% below where we were before the recession even started, and that's quite a long time ago. So,
and this is where, Christopher, I know we were communicating electronically, but I'm wondering if people are inclined to support adding the universal pre-K. I'm thinking challenged, because having students at a very young age start to have school, not be engaged in school, but have the opportunity for school. So I think that's an appropriate challenge for all young people, that we have universal pre-K.
I'm seeing nodding heads.
Yep.
All right. So if it's okay, with everybody, can we make that the first recommendation under challenged?
Yeah,
and then
I think makes sense.
push the others down to 2 and 3.
Yeah.
Okay.
And I can contact Beth too and see if she has any, particular documents to help us.
Okay.
I know she does.
Okay.
So we did also have some people who said we really need not to have more study when we asked the question about any recommendations that were missed, but really to work statewide, to collaborate, to reach all communities, and not just say one speech and be done, but to continue working on this as a daily important challenge was listed as very important work they want to see coming out of this task force. In addition, it's kind of repeated that people on the committee feel here, on the task force feel they've been doing this work and it's still not at the acceptable level. So the repetition here is for that collaboration, that really now's the time to bring people together and get this work done. So maybe that can be, put in the narrative too, that it's paramount, and maybe because of all of these things that we're saying, and people know how the climate is now, and gosh, with what's going on in schools, which is usually reflective of the society, right? That we need this work now more than ever.
I think it was interesting, and I'm kind of glad they worded it this way, because our charge included, identifying those things that are happening now and that are happening well. So I really do want to make sure that we're highlighting both the organizations outside of government, but also the government agencies that are doing good work, like the programs that judiciary has for kids in probation and so forth. But then make the point that, that's certainly necessary, but it's not sufficient. One thing else, I'm on the legislative, or have been for 6 years, on the legislative committee for ASCD, the national organization. One of the things one of the points we always make to lawmakers on Capitol Hill when we're in their offices is to view every piece of legislation that comes before them through the whole child lens. Whether or not it's ostensibly an education or seemingly child-related bill, but to look at that bill to consider how it will impact kids, if will it impact families and so on and so forth. So one of the things I was wanting to do in our report was to sort of highlight that. And I don't know if you guys know who Jason Reynolds is. He is the, what's his title? I have it right here. He is our national ambassador for young people's literature. And he was on Stephen Colbert the other night, and Stephen Colbert asked him, and I watched it on YouTube the next day because I cannot stay up that late. But he asked him, he said, well, Stephen Colbert said, I interviewed Maurice Sendak one time. And Maurice Sendak said, I don't write children's literature, I write literature, and other people have determined that it's for children. And so Stephen Colbert asked Jason Reynolds, is that how you view it too? And he said, well, no, with all due respect to Maurice Sendak, I am purposeful about writing literature for children. And he said, quote, who deserves our intention more than children? So I would like, if it's okay with everybody, to sort of include that line in our report, sort of early on to say, we're asking you, the legislature, really to basically do what we're asking federal lawmakers to do, to view every piece of legislation through this lens, to be very intentional about supporting our children. And I think that's sort of a good entree into the notion of the whole child, whole school, whole community, whole child framework. Alice, you were talking before about mental health. Do we want to include that in that same recommendation? It was engaged. We were talking about the fourth recommendation under engaged.
Yeah, I think, let me just throw some language together right now, Chris, and I'll send it to you if that's okay. But it would be more like assure that mental health services can be delivered within the schools with little to no barriers related to treatment plans and payment structures or something like that.
Okay.
I have to hop off just for 1 second.
Sure.
I'm sorry.
Yep.
Sorry.
I'm almost thinking maybe Alicia or everybody else, if you can look at recommendation H6, we might be able to tweak that wording to do what she wants it to do, because we focus on the payment issue.
Yeah, I think that's a good find to put it together.
Okay.
Yeah. We can work to get them both in there.
Right.
So that does cover the responses that we received to the best of my ability to review them quickly. Anyone else?
Oh, Christine, I see your hands up. I'm sorry.
Oh, please.
Hi, I just wanted to let you guys know that I put in the shared documents, a very short PowerPoint about Public Act 2135, which is the School-Based Health Center Expansion Act that we're starting to meet on.
And you put it in the Google Share doc?
I did.
Okay. All right.
Yep.
Thank you.
Feel free to reach out if you have any questions on that.
Oh, perfect. I really appreciate you including that.
Yeah, I know. Alice had mentioned it earlier, so I just wanted to put that in there for you.
Oh, that's fantastic. Thank you.
Thank you.
As a...
How about Roseanne?
Oh, I'm sorry, Roseanne.
That's okay.
Yeah, hi, sorry. I have several things to say. The first was I was really impressed with the job that the two co-chairs did on this, and I want to thank you for all the work that you've put into that. It was very impressive to me. But I wanted to just say a couple of things. I'm not really sure which area anymore that they belong, but I'm still very upset with the gun issue for the kids, the gun issues in the school and their communities. And I'm not sure what in Connecticut, I know that there are some legislation. I'm not sure what needs to go beyond where it is, but I think that still needs to be looked at. And the other piece about the climate change and how it affects vulnerable children is a really big piece. And I think somewhere I read it's happening on our coast too, with the climate, that the coastline may be giving us a lot of problems. So the other thing I wanted to talk about a little bit was the what's going on in the high schools. You know, from what I understand, something might happen between a couple of people and then 50 other people go around to see, and people are so angry. I had to deal with so much anger last year with the elementary school children because they were told it's going to be a new year and COVID will be over. And one of the problems is COVID isn't over. There are no bookends to COVID. And every time we approach that, people get angrier and angrier and more out of control. And unlike other disasters where the behavioral health person might go in to help another area who's gone through a disaster, this is worldwide. So we have people who are helping people who are also going through it, but it's universal. So kids who may not have quote unquote behavioral health issues are furious, and there hasn't been enough staff brought in to be talking to these kids about what are you going through. They just, you know, we put them back to school. We think that's great. The kids are in school and they're furious. And then every time they hear something else going on, it's like, you know, are you kidding me? So I had to say that because, you know, the kids are exhausted, the people in the schools who are trying to help them, you know, and there just needs to be such an immediate response to help people, you know. The elementary kids I know are angry, never mind the high school kids. And it just kind of blows up, by my understanding, from, you know, one person and 2 people to 50 people. So.
I think you said it when the difference here is that it's not sort of, if you will, one and done activity and you have a limited population. It's everywhere and it's for a long period of time. And that's what we don't have the experience with, or seemingly enough people either, to be able to help. Yeah, we need to work that in, maybe even if it's part of the discussion, right? The narrative. Mm-hmm. Yeah. Help set the context. Yeah.
Yeah. We're still testing them though.
Oh, absolutely.
Because obviously that's important.
Anyone else?
So Alex and Devin are working with us today because Peter couldn't join us. He had another obligation. So one of the things that we need to do, actually, maybe we should wait. I know Alice stepped away. I don't know if Alice is back yet. We need to have a vote for this body to approve this slate of recommendations. So Alex, I don't know if you want to walk us through the.
Yeah, so I could just call through the members who are present and just let me know if you're voting in support of this document and or recommendation, and then I could tally it and go from there. Perfect, thank you. So we'll let you call the roll. Okay, I'll go through the Zoom list order here. So Alicia Roy.
Yes, affirmative.
Chris Cobley.
Aye.
And I apologize if I butcher anyone's names. Anne Marie Colina.
Yes, affirmative.
Alice Forrester.
She had stepped away, so we'll
No,
Okay.
Okay.
Carol Meredith.
I'm here, but if I may, could you just clarify again what we're voting on? Is it to forward the recommendations?
Yes.
As is? Okay. There won't be an opportunity to revise any of them, add to them from this point forward?
We haven't written the report. I think I guess our question is, and thank you for asking for the clarification. I think our question is, are we comfortable enough with this slate of recommendations so that we can go ahead and flesh them out as the full report and then transmit that? So you will have an opportunity to add some language, add some support, add some clarification.
Then my response is yes.
Okay, thank you. And thanks for asking that question.
Okay, Christine Velasquez.
Yes.
David Seifel.
On behalf of Commissioner DJ Gifford, yes.
Katie Durand.
Yes.
Kaylee Royston.
On behalf of Commissioner Hurlbert and the Department of Agriculture, yes.
Mike Dugan.
Mike, can you hear him? Can I go back to Mike and Alice, maybe, Alex?
I can do that. Roseanne. I'm definitely not gonna get that. Carp.
It's Weinstein-Carp, and I'm yes.
Okay, Ted Doolittle. And Tracy Duran.
Yes.
Okay. And those are the members that are present. I think Carol Meredith as a non.
I believe you got me before.
Oh, I got you. Who did I miss?
Is Alice there yet?
You haven't gotten Ms. Hughes yet.
Oh, thank you.
Tanya Hughes, Commission on Human Rights and Opportunities, yes.
Great.
Thank you.
Well, for those members present, it passes unanimously.
Thank you. And so I think we can ask Mike and Alice when they're able to return, we can ask them to record their votes as well. In terms of the report, I've started a very skeletal draft, so I'll be working to flesh it out. And I'll be sending that to everybody, you know, as it's as it's fleshed out, so that I can get everybody's input on it, you know, to make sure that it says what we all want it to say. Oh, Mike, you're back. Are you comfortable with us? We just did a quick roll call vote. Are you comfortable with us transmitting these?
Yes, sorry. Somebody called to donate 2 vans. I had to get off. I apologize.
Oh, yes, you did. Good on
Sorry.
you. Congratulations.
Thank you.
But as I say, if with regard to any of the recommendations, if you don't mind, if you haven't already, if you don't mind sharing other documentation and just sort of citing the recommendation or recommendations that it supports, that will be a huge help. Because I've never done this before, so I was looking at the Sandy Hook report. And so it seems to me that what we can do is, in the narrative, talk about each recommendation singly with all of the supporting documentation. But then at the end of the document, have just the comprehensive list. so that it's, however the legislators want to use the document they can. If they want to look at specific recommendations with all the supporting materials they can. If they just want the list for a given moment, they can do that as well.
And we may need to call the committee together. We may need to ask that this committee, this task force, does stay in session. Peter did mention that was a possibility too. So we'll see how things move forward after this first iteration is received and any reactions that we get. So I think that's all our agenda for today. Does anyone have anything else to add? And we can be in touch if there are possibilities for additional meetings or next steps, as well as be in touch with you electronically.
So
Tanya. Oh, Carol.
Carol, yes. So I've been struggling a little bit with this, so so bear with me here. I just think, these recommendations will survive, to the extent that they're realistic, and if not, they'll end up on the shelf just like many other recommendations. And I would just, as you're fleshing this out, Chris, I would just kind of keep that in mind, because I apologize. I did not see the survey before today's meeting, so I did not have an opportunity to weigh in, and I feel very behind here. But as you were going through it, there certainly were some that just didn't rise to the, level of reality for me as someone who's worked in the state for a while. I just would have us bear that in mind. If it's not sort of cut and dry and clear that it's a need, then it probably will not go anywhere.
I really appreciate that. Oh, Tanya, please.
And Alice, I was just going to say, I agree with you that it might be helpful for this committee to remain semi-active once the legislative session starts, because we may want to collaborate on things that we may need to testify on. There may be some bills proposed that may be, integral to what we're working on. So I think we should, stay in touch.
Yeah, Peter admits that does happen many times with task force, that they are given that opportunity to continue to meet. So that's certainly a viable option for us.
So let's ask Peter or maybe Alex. I don't know if Alex, you can answer this question. The way the statute was written, our task force sort of ceases to exist once we transmit the report. But so does it need to be a legislative recommendation to the Committee on Children that we're allowed to abide, or how does that work?
That's a better question for Peter.
Okay.
But once the committee has the report, they'll be able to review it, and I'm sure the working group members will be asked to come and testify on it when it's reviewed during the legislative session.
So we can talk to Peter then.
Yeah, but thank you, Alex. That's helpful.
Yeah.
And the survey, Carol and everybody else, the survey still is live.
Yes.
So, feel free, when you have a moment, which I know is, time is scarce these days, to feel free to go ahead and add to that, because that'll be helpful to us, because the way Alicia set it up really helpfully was recommendation by recommendation. So you don't even have to respond to every recommendation. You can just respond to the ones that that's not going anywhere unless that's more specific. Then you can do that. So.
Yes, I see it now, and I appreciate the opportunity to respond.
Yeah. No, absolutely. Go ahead, Alicia.
No, I can't tell who responded where, which was the point, so that it could be anonymous. It is time stamped, so I'll be able to tell anything that's been added after today, so I can be sure that we include things that we hadn't gotten a chance to see before today.
Okay.
Thank you. But I will say, I think, we're all committed, those of us who are sort of appointed, I think I can speak for us. I think we're all committed to seeing this work through. So, I'm very happy to testify to all the committees of jurisdiction as necessary, because I do think that that's my concern with this work going when we started was that because it came out of the Committee on Children, that if we only testified to the Committee on Children, it wouldn't go beyond the Committee on Children. And so we want to make sure that we're sharing this with all the legislative committees, but also with OPM and the governor's office. And I know one of our recommendations has to do with diversifying the teacher force. And I know that particular task force is chaired by the lieutenant governor. So I think it would be prudent for us to sort of reach out to her directly to show that, we're supporting their work and hopefully they'll support ours. So.
Yeah, that's the kind of collaboration I think that was, stated as necessary for this to really make a difference.
Yeah.
So thank you, everyone. Then I think there's nothing else on the table. And I think we can adjourn the meeting at 4:34. Thank everyone for their participation. It's been a wonderful challenge to work.
Hold on,
with
Alice is
everyone.
back.
Oh, Alice.
I'm
Yes.
sorry, I was on the phone with New Haven Public Schools.
Yeah,
trying to
that's
deal
okay.
with what tomorrow's going to look like.
Well,
Sorry.
Mike had to step out because he was given 2 new vans. Did you get anything free?
I didn't get anything free. I just have to send 14 clinicians to the schools tomorrow. So I've got to
Okay.
figure out how we're going to do that.
Yes.
So we did take the roll call vote to 2 things while you're on, and then actually we're going to adjourn just to get you on the roll call for do you support these recommendations?
I do.
So
Yeah.
that's an aye. Alex, we can tally that. And then Alice, the other thing we were talking about was the recommendation you were making. If we can change recommendation H6 to include the language that you're recommending, I think that'll make it more.
Sure.
Yeah. So just send that to us at your convenience, and we'll change that to reflect that. So then we have a slate of 30 recommendations, and that's good business, a good piece of business, I think.
I think so. Wonderful. Thanks again, everyone.
Thank you, everyone.
Have a safe and healthy end to your calendar year, and we'll look forward to talking with you very soon.
Excellent.
you.
Thank you,
Thanks,
everyone.
everyone.
Good night.
Thank you. Happy holidays.
Thank you.
Thank
too.
you.